Good morning, good afternoon, good evening, wherever you're listening to this podcast. This is David Valenzuela with I Wish, welcoming you back. Just a quick reminder, if you are not currently subscribed to our YouTube channel, hit that subscribe button, hit that notification bell so you know when we actually release another podcast. If you are listening to us on Apple, Spotify, iHeartMusic, wherever you get your podcast, give us a thumbs up. Go ahead and write us a review, things you loved about the podcast, people you'd love to have us interview on the podcast. Just interact with the podcast, you guys. It means so much to the channel. We appreciate it. On today's show, we are featuring Dr. Cleo Amelia. She is a functional medicine practitioner, also specializes in Chinese medicine here in the Coachella Valley. I am so excited to get into all things gut health. We're going to talk about heavy mold toxicity, proteins you should eat, seed oils that you should avoid, gut health, skin conditions, all things from a functional medicine perspective. And I'm so super excited to welcome Dr. Cleo to the show. She is a local practitioner here in the Coachella Valley. And we actually met, 2 years ago? It's been about
Yeah,
two
I think I
years.
think about 2 years ago,
I
at
think
an
it was like
open house that
2021.
I
So
did. And that's
yes, at
great.
an open house. So we can't wait to get into it because we know that the skin is so intrinsically linked to what's happening internally in your body. And you guys, Cleo obviously is stunning. If you guys are watching on YouTube or looking at Spotify, she is young, and I love talking to young practitioners because they are freshly educated on what's going on today. So, Cleo, welcome to the show.
Thank you. Thank you for having me.
So first thing, I'm interviewing an esthetician or a physician or whoever's on the show, I ask the question of what was your original impetus behind getting into functional medicine, Chinese medicine? Like what started the quest to become a doctor?
Yeah, so I'll just make this short and sweet because it can be a long story, right? But I think like many who come into the health and wellness space, it's through your own health and wellness journey or something that has happened to you or something that you have struggled with. So that was my journey as well. In my early 20s, I was not into health and wellness like at all. Like I worked in Chicago bars, like was in nightclubs, like stuff like that. And then probably about my mid 20s, I noticed a lot of autoimmune like health symptoms. I always had a weak immune system. Like as a kid, I had ear infections and eczema and skin issues, acne as a teenager, but it never really hit me hard until, or I guess I never was really awoken to it until my mid 20s when I started to experience like joint pain and really bad facial flushing and really bad fatigue, lots of food sensitivities, and it just sort of turned my life upside down. In my
Mm,
childhood, I had a very poor experience with Western medicine due to my mom being into a lot of pharmaceutical drugs. So I knew as I got older that just wasn't the route that I wanted to go down. So once I started
mhm.
experiencing all these health issues, the first integrative health thing that I did for myself was try acupuncture and Chinese herbal medicine. Knew nothing about it, as most people do. And after like maybe a few months with this Chinese medical doctor, I felt way better. A lot of my symptoms were gone. And fast forward like 3 years later, I didn't know what I wanted to do with my life. And I was like, you know what, I might as well go to Chinese medical school. And again, you know nothing about it. Like you don't know what you're getting yourself into. You have people that think they know about Chinese medicine and before they enroll in school, like you got no idea. So luckily, I went to my first
Mhm.
class and just immediately my phone fell off there. Just immediately fell in love with the whole theory, how beautiful Chinese medicine is, and obviously having the background of it working for me, that was an added benefit. And then throughout school, I continued to do Chinese medical treatments with other practitioners and get acupuncture and herbs, but there was still like a missing piece for me. Like I felt good, but not 100% good. I was probably like 75% there. And that's when I was introduced to functional medicine. So I went to a functional medicine doctor. They did all of this blood work that I had never heard of, put me on all these supplements that I had never heard of, and really just opened up a whole new world that I, again, knew nothing about. So that was basically, my introduction to Chinese medicine and then functional medicine. And throughout this whole health journey, not only was I experiencing like a lot of physical symptoms, but it wrecked my skin. Like I said, I had tons of facial flushing, I had tons of redness, broken capillaries. Just I was not even 30 yet, and I felt like I had so many signs of accelerated aging when I looked at myself in the mirror. And when I started to feel, close to 100% better, I was like, well, I'm left with this mess. Like, what do I do? And so that's really what sparked my interest in, combining the whole world of, well, how can we feel our best, but also look our best?
I love everything that you just said. So there are a lot of people that will find their way into a profession based off their own personal experience, whether that be acne or they have some medical issues that they can't actually get around. So they're like, I need to start educating myself on why this is not working. I think, Cleo, what a lot of people don't necessarily understand when traditional therapeutics fail them, that they have other options. So, as you know, being a practitioner here in the United States, we love to treat symptoms, and I'm always saying that about Lipitor being the number one drug prescribed in the U.S. But we still want to go to McDonald's and we'll take Lipitor. We don't want to adjust our diet to ultimately feel better. We would like to treat the symptom. Um, it's very interesting, which is why I'm so excited to talk to you, because you obviously get it. Can you explain the difference between what you do as a functional medicine, Chinese medical practitioner, and a traditional Western trained US physician?
Sure. Yeah. So a little bit about the difference between Chinese medicine and functional medicine to start. At the end of the day, the theories that both of them are based in, there's not really a difference. And for me, that's why I love to combine them. Like we're always thinking about function first in the body. So again, not just treating the symptoms, but really realigning the body's functional systems in order to handle whatever is happening in the body. Like take for instance constipation. Like you're not just gonna like push out the stool, like fix why the person is constipated. Like why can't they go to the bathroom, right? uh, so always
Right.
function first, always root cause first in both Chinese medicine and functional medicine. So again, not just these branches of symptoms, but treating what's causing the symptoms. And then for me, both are really about balancing the person. So one, meeting the person where they're at, um, building a treatment plan based on like their lifestyle and what they're looking for and their goals, and obviously what's going on with their health. And just bringing their whole system back into balance, whether that is mind, body, skin, the whole shebang. And I think that those theories alone are what make Chinese medicine, functional medicine stand out from Western medicine, where Western medicine is very, here's this set of symptoms. We don't really care why. And here's a pill that is going to solve your symptoms, but not necessarily fix the
Hmm.
underlying issue. So while you may feel better, one, there's consequences of taking those medications, and two, you've learned zero about your body and zero
Hmm.
about why that's actually happening to you.
Right. Right. Which is so super important. And I was joking because the my business partner's family was visiting. They're probably going to listen to this, so don't, Steve, if you hear this, don't be offended. But he was basically saying we were at Whole Foods, and I was getting a juice, and I'm like, I always am like, get the apple out. I don't want the high glycemic fruit, right? I just want the kale and the spin. Like I want the good stuff. And he said, "Oh no, I can't drink any of that because of my blood pressure medicine." And this is not the first time that I've heard somebody say that exact thing about, oh no, I can't have green leafy vegetables because it will mess with my blood pressure medicine. And I was like, what do you think your blood pressure medication is actually doing?
Yeah, it's so bizarre,
I'm
right?
like, if we had some more things like that, It's bizarre, but at the same time, it's literally what we're taught to believe in, especially in the United States, that we're. And I know we could get into the whole pharmaceutical industry and follow the money trail, and I know we could go crazy down that wormhole, but we don't have we have like a sick system as opposed to a wellness, healthy, like let's get into let's get into this therapeutic before you're diabetic or before you become morbidly obese, as opposed to only treating it and having insurance pay for it while it's actually happening. It's very, very interesting to me. And so that's why I love our functional medicine practitioners, because you're working on getting to the root cause of something versus just treating a symptom for something. And that it's not as, I don't know that the general population even understands that a functional medicine physician is actually an option for them. They're like, this is what I do. So I go with my insurance and I go to this doctor and I do what this doctor tells me. And you know that us being an acne brand, we see the other side of the traditional medical thing. And we have, I think I told you before, but we have clients that have been on antibiotics for multiple years. And I'm like, dude, that was never the intention behind an antibiotic. Spironolactone, and then the people are complaining I have headaches really bad, or I'm having to urinate frequently, and I still have acne, and it's not helping me. But the general or sort of like common denominator between all of the stories is that the acne comes back. And so whatever physician, dermatologist they went to initially, whether it's general practitioner or specific dermatologist, they're given a therapeutic. The therapeutic might have some sort of effect for while they're taking it. Accutane, as we know, which I say is the holy grail of side effects. Those are the ones people complain about usually the most. Within 3 to 6 months, their acne starts coming back, which says we haven't treated the root cause of why you actually have acne. And we know there's some genetic predisposition, and we know it can be caused by some products. There's a whole combinations, and we always say one size fits one. But I want to ask you, I know, so you guys, this conversation started because, I'm paying attention constantly to what's going on in the space, of course, around acne, because we're hyper focused on it. So I sent Cleo this supplement that's been marketed to me. And I said, what are your thoughts about it? So Cleo, can you first of all talk a little bit about what you see in your practice when somebody comes in with acne? Walk us through the steps of what you take for somebody, like they just come in, brand new patient, all the questions you're asking them, their intake, and then give us a little bit of your protocol for how you would address that.
Sure. So to start, I mean, the theories of Chinese medicine and functional medicine, are the same. That's why I blend them. But my protocols for how I conduct each of the treatments, or each of the intakes, I should say, are quite different. And I can go into that a little bit. So obviously, when a person is
Yes.
coming in for functional medicine, we'll start there. That intake is much longer. Like, we're doing a full health history. Like, we talk for at least 60 minutes about everything that has ever happened to them, everything that they've tried, all the systems in their body, from digestion to mental health to hormones. I'll review any blood tests that they have that they've recently done. And I'm looking at the whole picture, like body, mind, soul, and skin, right? And looking at, not only what they're putting inside their body, but what they're putting outside of their body as well. From there, we end up usually doing more blood work, and functional medicine blood work is much more in depth than your general blood panel. We're one, looking for pathology, but we're also looking to prevent pathology. So we're not just like searching for disease. We're looking how can we prevent future things from happening. So we'll do all of the blood work, and then once all of the results come back, we meet again. And based on all that blood work, then that's where the treatment plan comes from. Not only from what they're telling me, their health history, but also from actual data that's in front of us. And everybody's treatment plan is going to be different for acne, for anything. So,
Yeah.
Joe Schmo could walk in with acne due to digestion issues, and, Sally could walk in because she has some raging hormone problems. Like, they're going to be treated completely differently. They're not going to be given the same acne protocol. Chinese medicine, on the other
Yes.
hand,
Which I
yeah, go ahead.
I was just going to say, yes, it goes back to that one size fits one approach. Everyone's a
Mhm.
unique individual and should be addressed accordingly.
Yeah, definitely. And then the Chinese medicine side of it. So Chinese medicine consists of acupuncture, herbal medicine, cupping, gua sha, cosmetic acupuncture, things like that. So that intake is a little bit shorter. Um, the review of systems is just a little bit shorter. I do a lot with pulse diagnosis with my acupuncture and Chinese herbal patients. So I actually did this advanced herbal training that's all about pulse taking. So not only from what they're telling me, but
Mm,
also what I feel in their pulse. That's where I'm coming up with the treatment plans. And it's less about lab testing and Western medical ideas and technology and more focused on the ancient, tried and true, time tested things of Chinese medicine. And they do come together, but a lot of my patients are either one or the other as well.
Is there thank you for that description. That was awesome. And I'm sure just enlightened a lot of listeners about what the differences are and the combination of the two. Obviously, super helpful. Is there a situation where you would rely on a traditional therapeutic in combination with like herbs? Like, is that ever a situation where you're like prescribing one in combination with the other? Or is it you try to keep the majority of somebody in one category of treatment?
No, like a lot of my functional medicine patients, I do Chinese herbs with them as well. So I do combine that more in the functional medicine appointments because we have more time, there's more space to do it. Whereas the Chinese medicine patients are strictly Chinese medicine. If they want to do both, then they have to jump into the functional medicine. But usually with the patients that are doing both, it's like they're on Chinese herbs and they're on, you wouldn't call them pharmaceuticals, but Western medical supplements or, hormone creams or hormone
Yeah.
supplementation or something like that. So I love the combination of both. I think both are very beneficial and are amazing when you can do both of them.
Yes, combining the two, right? I love it. I think that it's super, super awesome. So you obviously seeing you guys, so we're in the Coachella Valley. So we do have a younger population. We also have an extensive older population. A lot of people come out here to retire. It was a lot of secondary homes before we got through the pandemic. I was saying on the podcast this morning that my community was primarily just secondary homes that people would use to come out on the weekends from Orange County and LA. And once the pandemic stopped, everyone just kind of stayed. A lot of remote working, so like it changed the valley. But we definitely have a older demographic. So we do obviously have acne. We do have high schools and teenagers and such. It's just a little bit of a different landscape than most cities that you're in. When you see Cleo, that when clients come in, like what are you seeing as the main causes of skin issues that you see day to day, people coming in for your clinic? Is there any common denominators amongst the people that are coming in complaining about a skin issue?
Sure. I mean, one of the glaring things is gut issues. And even oftentimes when people come in and they're like, they think it's all hormonal, like, oh, I have hormonal acne, I only get it on my cycle, it's cystic, yada yada. Often even before that I'm looking at hormones or doing any hormone testing, like, what is your gut like? Let's start there. Like, you got to work
Yeah,
upstream, right?
yeah,
So for me, like, that's the most
yeah,
important piece of the puzzle to look at, because if you can't get like the center of your digestive fire correct, then everything else is going to be off. So I rarely start with hormones or hormone testing or anything like that. So one being gut, two being toxic load, so like heavy metal toxicity, mold toxicity, even things like BPAs. Like I constantly see high BPA levels in a lot of my patients, meaning like from plastic. So whether they're using like plastic water bottles, plastic
yeah.
food containers, um, whatever sort of plastics, that can contribute to a lot of skin issues as well. A lot of my mold clients have a lot of issues with skin.
Do you see, I know because you guys were, for those of you that are not geography savvy, we're in Southern California. We're in the Coachella Valley, which is 2 hours and change west of Los Angeles. We're like literally neighboring to Arizona. We're in the desert. We have a very traditionally dry climate out here. So are you seeing people that are having mold issues with valley residents? Or are they coming in from living somewhere else and then having mold sensitivity?
No, there's mold everywhere. And the
Oh,
desert is
interesting.
getting way more humid than it ever has been. And
Yeah.
there's a lot of dust, and there is a lot of water here, and there's a lot of pools, and there's a lot of moisture from gardening, the golf course. And most of the houses here are old. So, if
Yeah.
you take that into consideration as well. But I do also have patients that have lived at the beach or near water, even like 10, 15 years ago. They're like, yes, I saw mold on the wall in my house 10 years ago, and they still have mold showing up in testing because they've never actively gotten rid of it, or they're predisposed to having detoxification and liver issues or something like that, where, one person that may not have that may get rid of the mold quickly versus somebody who just has a little bit of a weaker system, just hangs on to things.
Right. So the what I think is interesting and why I love talking to you, because obviously diet is a whole huge thing. Your lifestyle obviously being affecting it. We'll talk about toxins and what that looks like and that load and skincare and what's it called? Bisphenol A. That's BPA, right? That's what were making plastic bottles out of a while ago.
They still
And which
do.
is just like disruptive to hormones. They
Correct.
still make water bottles out of it.
I mean,
Ooh, yeah.
some
This is why
cheap
we
stuff
are
that
buying
you
our.
can buy on Amazon. I mean, the other day I ordered like uh, salt or pepper grinders on Amazon, and they were made of
Yeah,
that had
yeah,
BPA in it. And you open it, you can smell it. It's like, why would I put my spices in this? But most people don't think like that. They're like, oh, just put your spices in here. Well, the spices are touching the plastic, and you're grinding plastic into your food. So it's just
right,
teaching
right.
people
Not good.
that this stuff is out there and that we have to be mindful of it. And obviously, like, opt for the glass pepper grinders versus the plastic ones.
The plastic ones, right, right. So you guys, the FDA and the EPA, that are essentially consumer protection agencies, right, in the United States. So we talk about, I had somebody on from Canada a couple weeks ago. They have Health Canada, and then you've got the EU, the European Union, that manages Europe's situation, and you've got the TGA in Australia, which is like their version of the FDA. The thing that's interesting is we all have different regulatory requirements, and we often hear a lot about, oh my gosh, the European Union has over 1,300 banned ingredients in skincare, and we only have 13. And you start looking at the stuff, it's like jet fuel, and I'm like, okay, well, obviously we would not be putting jet fuel in a cosmetic product in the US. But it's interesting that how different countries regulate what is considered safe for a consumer. That I formulated a sunscreen for a company that I worked for previously that was distributed in Australia, and they test their UVA UVBs different because there was a hole over the ozone layer, and they had a very high incidence of skin cancer, the highest in the world actually, because of the ozone was depleting over Australia. So they test their SPF differently. So they have different stringencies. So like an SPF 50 in the United States was only registering an SPF 37 the way that they look at their sunscreens. So when we look at the safety of our food, of our products, of the packaging, it really becomes up to you, the consumer, to make educated choices about the options that you have. So if you have something that is not going to off gas or could potentially leach into a liquid product, or an herb or something that you're trying to dispense, a salt or pepper shaker, and glass is the option, there's a reason why we do stability testing in glass, to make sure that formulas are stable. So, I mean, I think that it's great advice. But also, just even if you do order something from Amazon and you're noticing you can smell that plasticky, that cheap plastic smell, everyone knows what that is. It's definitely in your best interest to research that and not try to put that into your food. Please don't put it in your
Yeah.
food. So, Cleo, the when you're explaining like the types of testing that's available to them. So, I know, and we've had conversations about it, but the way that you will order blood tests and the things that you're looking at in blood tests. So, for like, I know obviously if we go to a traditional physician, we're having a physical, they're looking at your cholesterol, they're looking at your AC1, they want to see, are the thing that's interesting to me, and you probably have an opinion, I would love to hear it, is we the metrics for which we hold, they consider in the healthy margin, so to speak, of like where your blood lipids are or where your blood sugars are. um Talk to us about how you would actually look at that versus what traditional medicine those markers are with the types of tests that you would actually order.
Sure. So, one, when you go to your general practitioner, Western medical doctor, they're not really ordering that much stuff in terms of blood work. Like they're looking very basic. It's just the foundation of things. And if they see something, according to them that's off, they might order more tests out of that. However, their reference ranges are just so wide. Reference ranges are developed
Yes.
based on population. So basically, like, okay, all of the people that live in a certain area, let's say the Coachella Valley, that go to the doctor and get this test done, they take the reference ranges based off of that. So they can change based on location, like from here versus Kansas City or something. Like you may notice that the reference ranges are different, like each place. Um, and oftentimes,
Mm.
people that are going to the doctor are one, unhealthy, because we live in an unhealthy country, just being honest. um, and two, like
It's
for
true.
our our demographic here in the valley, they're all so old. Like, of course, the numbers are going to be a little bit different. So I really pare
Yeah.
down the reference ranges into something that's considered more optimal health, or where we can actually see issues that may start to arise if we don't catch this now. So, instead of like glucose, for example, I don't even know what it is for Western medicine anymore, probably like 70 to or 65 to like 100 or something. And then over 100, they're like, oh, you're pre-diabetic, whatever that means. Um, but I narrow
Hmm.
it down to like 75 to 85. And once you get past that 85 mark, it's like, okay, we're going in the wrong direction. There's been research studies done that when you get to a fasting blood sugar of 89, you start to gain weight. So why are we waiting till you get to
Mm.
100, till you're pre-diabetic, right?
Right.
Like you can see things that are
Right.
starting to creep up and we want them to go the other way. So not only that, like the
Hmm.
reference ranges and just looking at a little bit more narrow lens, but also running other panels. So for cholesterol, for example, what you brought up, they look at LDL, they look at HDL, they look at triglycerides. That's it. Well, out of context of inflammation, or are your arteries clogged, or do you have high blood sugar or any other issues, like those numbers don't mean much. Like we need cholesterol, our body makes cholesterol. We need it for hormone production. It's a defense mechanism in the body. So just providing me with an LDL calculation means nothing to me. Like, are those LDL particles inflamed? Are
Yes.
they small and dense? Are they getting into the arterial lining, clogging them? Are they healthy cholesterol particles? Like, what are your inflammatory markers? Like, I don't really care about the LDL unless you're giving me a much more broader picture of what's happening.
Yes, and the so this conversation, so I want to talk to you about cholesterol for a second, and then we can jump into something else too, because I think that the
Hmm.
the insulin response, or the starting to become insulin resistance and things like that, when people start experiencing some issues from a high refined carbohydrate, lots of sugar in their diet long term. Um, I d- I read, or I saw a study recently about, about the blue zones where people
Yeah.
live like the healthiest and the longest. I think there's one like Loma Linda, which is weird because there's a Loma Linda for you guys is in Southern California. It's not that far away from us. But they were talking about people that had centurions that had reached 100 years old and were essentially healthy still at 100 years old. And what the study was noting was that they all had what we would consider high cholesterol levels.
Mhm.
And I thought, this is very interesting because we have a very limited view of cholesterol, and you're going to have a heart attack and all your arteries are clogged and you need to be on Lipitor. And very few people, and the thing that we try to convey when we're talking about people, whether it's a skin issue, a health issue, whatever, is that you need to really have an intelligent conversation with a physician that is your prescriber for a medication, on what really the ramifications are for your total body. So not just one, this is why I love functional medicine, because it's not just one thing. So if you take Lipitor and it's now going to do something with your cholesterol, what else is happening in your body? And no one likes to talk about that. Like, cholesterol is something. When I had a conversation about the sun converting cholesterol in the skin into D3, like how the synthesis of that actually happens,
Right.
people are like, wait, they're not even thinking about cholesterol and the sun and D3 like that as that a mechanism of the skin. Like, totally.
Mhm.
Like, who has ever talked about that?
100%.
No, we just think
Yeah.
cholesterol. We're eating French fries.
Right. And
We're
then
eating
they put
French
people
fries all
on
day
like,
and I have high
yeah,
cholesterol.
they put people on low fat diets
So
and then
it
and then they have no vitamin D. It's like, okay.
It's so ridiculous. So I remember so I did have he's now since retired, but I did have a good physician in Atlanta, and I was having my routine physical. He would order a lot more tests than traditional, what I had been exposed to in California prior to moving. And he's like, David, do you have sunscreen in your products? And I was like, well, duh, I'm in the skincare industry. Of course. He's like, you have virtually no vitamin D in your body. Like, and he gave me a prescription vitamin D for like 20,000 international units, like to get my levels back up. And I still, even living in the Valley, we're indoors a lot of the time. I definitely wear SPF on my face. I'm in the skincare industry. I get it. But even me living in a very sunny place, I don't have enough unprotected sun exposure to actually keep my vitamin D levels healthy, which I think is interesting because that leads to a whole other host of things for long-term vitamin D deficiency, which I didn't even know were a possibility. Very, very interesting. So, Cleo, let's talk about, because we have such high sugar, refined, crappy foods in the West, which, I was just telling you right before we started recording, I just spent 2 weeks in Atlanta. And every time I go back to Atlanta, I'm shocked with the regular grocery stores, how small the produce section is. It's this little tiny, tiny thing in the corner of the grocery store. And I'm just like, wait a minute. That's how you know when you're coming from California. We have a lot of produce. So talk to us about when people start showing up. So people will come in, obviously their skin is inflamed, they're having acne, they're experiencing these issues, but they don't understand the link between eating a lot of inflammatory foods, like having a lot of dairy in their diet or having a lot of sugar in their diet, which then can you explain to the listener about how that is affecting their insulin, what's actually happening in the body with the consumption of that stuff over long periods of time?
Sure. Yeah. Like, where do I start? Right. Well, okay. Let's get dairy out of the way, right? So I
Yes.
think that people are over demonizing dairy, to be honest. If you're eating like organic, good source dairy, you really shouldn't have a problem. And if you are having digestive issues or skin issues because of dairy, that's something that's going on internally with you. Like you're lacking an enzyme or you have some sort of gut issue. And while we may need to remove certain foods for a certain period of time, the end goal is to not live in a box. It's to be able to eat dairy and be able to eat foods that, our ancestors ate and things like that. Uh, Sugar, on the other hand, sugar from fruit or sweet potatoes or anything, natural sugars like that, like totally fine. It's the problem with the highly processed sugars. So even in protein bars or obviously like candy bars or packaged goods where sugar's hiding, or even salad dressings, most people don't think to look
Mhm.
there. And it's this constant flood of sugars into the system. Like we never give our bodies a break or to catch up. Like there was this whole theory for a while that you would eat every 2 or 3 hours, and that was like the best way to be healthy.
I remember.
but but our
Yeah, I
bodies like
remember.
yeah, our bodies like need a moment. It's like you give the body food and then you let the blood sugar return to normal. But we live in this society, in this culture where food is readily available all the time. There's food around us all the time.
Hmm.
You know, we're going to coffee with this person and having a sugary latte and then a muffin at this meeting and then lunch and then dinner and then dessert. And it's like our glucose, our insulin receptors that shove glucose into cells and into muscle and stuff like that just get overloaded. Like it's a big old traffic jam. And once you get overloaded, the cells and the
Hmm.
receptors are like, okay, I've had enough. And that's when you develop insulin resistance. Like you cannot push the glucose into the cell, into the muscles. It's not usable anymore. It's floating around the bloodstream. And when you have all this excess glucose in the body, it can oxidize and turn into inflammation in terms of skin health. It can actually change the structure of collagen and elastin in the skin, weakening it, you know, making the skin thinner. Kind of oxidation on the skin looks like that cross-hatched pattern, if you know what I'm talking about, like texture on the
Yeah.
skin,
Yep.
things like that.
Yeah, I say so I can tell like walking through the airport or when somebody, presents themselves and I'm like, well, they have a lot of glycation in their skin. The cross-linking of collagen, what you just described, is usually like a tall tale sign. And you can see on people's faces when they have a lot of cross-linking. They've had a high glycemic diet predominantly, or they drink a lot of wine. I love to have a nice glass of wine every once in a while, but I'm so crazy now. Like I'll make sure I have a protein in my stomach before I actually drink the wine. I'm like, no, no, no,
Mm.
we're not going to start with a glass of wine. We're going to actually eat a little bit of food first, and then we're going to sip the wine slowly.
Yeah.
Don't listen to me, you guys. Just my own personal advice for like not crazy spiking my blood sugar. But no, I get it, and we have such a the idea behind your internal gut health directly impacting what is happening to your skin. Now, I've worked obviously in the cosmeceutical industry for next year. I'll be going on 30 years, which is nuts because it makes me feel like, how old am I? Like, what have I been doing? What's going on? How long? But we have treated a lot of things topically over the years, which can help. We can change the moisture level in your skin. We can refine texture. We can do a little bit with pigmentation. But if you ultimately want to have the healthiest skin you can have, your diet is going to directly impact what is showing up on your face. I haven't been able to get back to yoga since traveling for 2 weeks. I didn't exercise while I was on my trip. I can see just talking to you today, like I'm a little puffier than I would normally be right now. I haven't really been sweating or getting my heart rate up or doing any exercise. I know my body enough to know that I got to get my exercise routine back on because I've been eating a lot of processed food, having Southern food, lots of salt, all the things that go into. I mean, I was eating at a place called the Flying Biscuit, if that tells you anything, in the Waffle House,
Love
all
it.
my old haunts. So
Yeah.
it's just one of those crazy, crazy things. So if somebody, when you look at a new patient come in, so let's talk about, I know we have an older population here. We're talking about the mold exposure and stuff. So let's talk about your younger patients. So let's just say somebody comes in, women are the fastest growing prevalence of adult onset of acne. And when I was originally developing Wish, I said, okay, you have to like design your packaging and your logos for who your end consumer is going to be. Like, right, marketing 101, who is going to be using this product? And I said, she's going to be 28 years old. She's going to be graduated from college and she's educated. So she's not going to buy a drugstore product, but she's not really wanting to spend the $200 for a bottle of SkinCeuticals. So she's like, this fits my price point. That's what I thought who was going to be the end consumer. So what I now realize is it's really about whoever the client base is for the aesthetic practice they're going to see, whether they're treating all teenagers or they're treating all adults. I have practitioners that just treat hormonal adult acne and they're like, I'm fine with that. And I have practices that treat all teenagers. What I want to hear, Cleo, is how would you treat the adult female client that's experiencing hormonal acne versus the teenager with, the obviously the hormones and puberty and all that stuff? How would you address those clients differently?
Yeah. It's funny that you asked this because I was just on a call earlier where we were talking about women and their different cycles of life and how you would treat like somebody pre-menopause versus postmenopause. And somebody brought up a really good point is
Yeah.
that like it's all the same. At the end of the day, it's all the same. Like what we're all this we all got the same parts. Like what is going wrong in the system for
Mhm.
you to have the acne at no matter what stage of your life? And obviously there's more prevalent causes in teenagers to get acne versus somebody that is, you know, later on in life and approaching menopause. But at the end of the day, you still got to look at the same symptoms. Like, where's their inflammation? What is their gut doing? What is their stress level? You know, how is this impacting hormones? And where do we start? That's the biggest thing with my patients. Because a lot of times, like, people come in and it's like all their hormones are out of whack. They have small intestine bacterial overgrowth. They have mold toxicity. They're full of heavy metals and they have Lyme disease. Like, where I'm sorry for this person, but where do you where do you
Yeah.
start with somebody like that? And I think there's a lot of doctors out there that may put people on like lengthy protocols, or here's 25 different supplements. You know, do this hyperbaric oxygen chamber and do this IV and you'll be fine. But why don't we just
Uh-huh.
start with like, what do you eat for breakfast? Do you look at your phone, you know, right
Mhm.
before you go to bed? Like, let's start with really
Yeah.
basic things. 'Cause I think there's a lot of power in figuring out those little details of people's lives that can truly make a bigger impact on hormones and gut health and things like that, rather than shoving the kitchen sink down their throat. So I don't really know if that answered your question or if I just went on a tangent, but
No, I love it. No, it's true. So I think that the prevalence of, so I have a couple theories. These are just my opinions, you guys, so just take it for what it's worth. I believe the prevalence of PCOS, the hormonal acne that adult women are experiencing, has been predominantly due to a long-term dietary choices that have now manifested in a condition that is now causing them to have acne. You know, there's a lot of the teenage, so, and Cleo, you can correct me if you disagree with this, because the all of the research that I've done for acne and microbiome health and understanding prebiotics and probiotics, we know a lot about gut health. The topical microbiome is coming more into focus as more research is being done. We're understanding dermatitis, psoriasis, eczema. There's some microbiome things happening disrupted when when these things manifest on the skin. What I'm seeing is that most people are a lifetime of choices has now led up to, you know, whatever skin condition they're currently experiencing. But usually with acne, and all the medical research I can get my hands on about this, is that there is a genetic component to somebody that has acne. It's been in their family tree somewhere on mother's side, father's side, somewhere in the family. Somebody else has had acne. And my personal experience, I have two sisters. My middle sister had terrible acne all through high school. And I had acne probably for like 2 weeks when I was like 14. I like broke out really bad on my forehead, but it was like done really, really super quick. I was probably running to the drugstore and getting Clearasil back in the day because that's what we had available. But my sister was on, you know, they were giving her, you know, Retin-A, you know, topical retinoids. They were giving her rounds and rounds of antibiotics. Back then, they were doing blue light therapy, which is essentially like putting yourself in a tanning unit. And she had a demarcation of pigmentation on her jawline to her neck from using the topical. And it was just all of those things. But yet, my youngest sister and myself did not experience acne like she did. So I think that the education that we're trying to provide for people is that we all have the bacteria on our skin that causes acne. It's present, it's part of your microbiome ecosystem, it's keeping staph at bay. The differences is that if you are predisposed, there somewhere in the genetic history that there is acne, that you could develop acne. And that's when you have to make choices, adjustments to your diet, your topical skincare usage, because like you were saying earlier, you know, not everybody, and you know, actually, I'm going to ask you this question before I go off on another tangent. Explain okay, so you talked about Lyme disease. Explain to the listener why some people are super affected by it and can be up to a debilitating disease, and other people can simultaneously live what is considered a normal life with having the same disease. Can you explain that a little bit to us?
Sure. So background, I have Lyme disease. That ended up being, what my issue was with my health all along and what we discovered along the functional medicine route that I did go on with the testing. And Lyme disease is very difficult. I have some people say that, or practitioners say that cancer is easier to treat than Lyme disease because Lyme disease is one
Wow.
so unpredictable. And again, it affects everybody so differently, down to like different symptoms or different parts of their body. And again, like the severity that you mentioned. Um, so there's a couple factors that I think and that research has shown too that, why Lyme disease affects different people, but it is still a kind of a developing land, Lyme land. Um,
Yeah.
one, yeah, one, like how many times has this person been bit? What type of tick, or not type of tick, but what type of Lyme is in the tick? Or do they have co-infections like Bartonella or Babesia or Toxoplasmosis or anything like that? And what state was their body in, like when they got exposed to Lyme? How soon was the Lyme treated? Like obviously within the first 2 weeks, it is you have a better outcome if you treat within the first 2 weeks versus waiting 5 or 6 years like I did. And what are the treatments that you're doing? Because again, for every single person, Lyme treatment is going to be completely different. But at the end of the day, like what has worked for me best, or how I felt my best dealing with Lyme, is not focusing on killing some sort of bug or killing the Lyme that's in the body, but focusing on cellular health. So how can I make my body the strongest temple cellularly? How can I get my cells to function the best and be resilient and strong in order to deal with this ever-changing viral load or bacterial load that is in my body? And I think that's where like a lot of
Yeah.
people miss the mark with Lyme. It's like they're trying to go after the Lyme. Oh, you can kill it. You can kill the Lyme. It's like, no, we're always going to be
Hmm.
exposed to something in the environment, whether it's Lyme or plastics, like we talked about, or anything else. Like we all have cancer cells. Like, how can you make yourself the best version that you can be to handle all of these different stressors?
Right. Which is huge. And I think again, back to the one size fits one approach to people, because there are a lot of we the other thing that gets me all uppity is we when somebody gets a therapeutic, a prescription, you guys, I say therapeutic, prescription medicine, we prescribe like the same thing to multiple, like whether you weigh 250 pounds or you weigh 100 pounds, you're going to get the same dosage. And it's just a one size fits all approach. And you don't we like to I say this lovingly, so don't be offended, you guys, when you hear this, but I like to say we throw therapeutics at dumpster fires and we expect it to be just like this miraculous healing of outcome. And I'm like, well, there's not healing. You're just treating a symptom. So you might eliminate that symptom, but you didn't address the rest of the dumpster fire. That's the health coming into the whole situation. I'm like, oh my gosh, I could go off on a tangent, Cleo. Like it gets me so riled up. So I love, look at, we're already, I mean, I could talk to you for hours and hours, but I'll keep this moving. So a couple things before we get, I know we want to talk about detoxification and get your thoughts on detoxing, but explain the thing in the West, we have, when you explained this to me once, which was beautiful, about how Chinese herbs are so very specific. And we have this multi-billion-dollar industry in the United States that is about multivitamins and omegas, and I was telling you about all the things that I take, and I'm like, maybe I should be taking all those things. Would you explain why the traditional supplement aisle at the grocery store is not necessarily the best thing for your health outcome, and like why it should be a little bit more specific than just a general one size fits all approach?
Yeah. One, I'm not a big fan of supplements that they sell at the grocery store. Well, one, I mean, what's in the capsule, you don't really even know if what you're getting is true. And two, just the quality tends to be not as good as if you're working with a practitioner only sort of brand. And that's not saying that every supplement brand
Mhm.
on the shelves out there is bad, but for the most part, like a lot of stuff I see at Whole Foods, it's like, ugh, like please do not take this. And two is you're just like
Yeah.
going to the store or shopping online and you're like, oh, I heard this is good for that, or this is good for that. But is it good for you? Like, again, bringing it back to the root cause and the mechanism of action. Like, just because something is good for, that symptom doesn't mean it's going to fix why you're having that symptom. Uh, or, if you're taking something, but something else is off in your body, you could actually do more harm than good. Like I was just reading a research study the other day that like taking high doses of turmeric or curcumin are detrimental to people with low testosterone. And it's like, okay, well, if people have
Interesting.
really bad joint pain, and they're like, oh, I'll just take a bunch of turmeric, but they have like zero testosterone already. It's like, well, what are you doing there? So I think there needs to be data to support why you're picking up something off the shelf, supplement wise or herb wise, and putting it into your body. There's professional healthcare providers for a reason. Like I wouldn't dye my hair at
Mhm.
home. Why are you buying supplements yourself on Amazon? Like, you know,
Right. Right. Well, and I have fallen into the trap over the years, whether it's been attending a trade show or even having like these naturopathic physicians, talk about. We were total side tangent, but we when I worked for Aveda, Horst was who is the founder of Aveda, who's since passed away. Rest in peace, Horst. Great influence on my life. But it was about 96, 97. We had these naturopathic doctors come in and they were explaining the the lack of nutrients, what we had done to the soil in the United States.
Mhm.
And they were explaining the difference of a certified organic tomato versus a traditional tomato that was grown with some sort of pesticide or whatever, but the nutrient density was so low. So we launched this supplement line. It was called Intelligent Nutrients. And I was like a fanatic. I'm in my 20s at the point, and I was like, oh my gosh, I eat Taco Bell. Like, I'm probably getting no nutrients. What the heck? I'm eating like this ridiculous diet. And so I started going to the crazy place where I'm like, I need this. It was called Intelliderm, and I need Metabotherm, and it had chromium in it. It was like for my metabolism, and there was green tea, and then we needed the multivitamin. And then, oh my gosh, if we ate too many salty foods, you take Aqua Balance because you're too puffy. I was getting crazy with all of the different one single thing to approach the stuff, which is as opposed to saying, well, maybe I should exercise. Maybe I should stop eating Taco Bell when I'm out in my room doing my drive. Like, let's
Yeah.
just take a vitamin and eat Taco Bell. Like, no, 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 no. It doesn't work that way. So I have fallen into that trap where you walk down, even, over here at Clark's, like I walk through the aisles and they have a supplement person there and they're like, well, what is, they're asking you questions and you start looking at the supplements. And you're like, oh, I need that. Oh, I need that. Oh, I need that. Oh, I need that. And then you would walk away with 500 supplements, not even connecting the dots in your head that all of these things can be attained through food. Like that's where they come from. They come from food. They come from plants. Like this is where the stuff comes from. But we're just like running around like robots, like, oh my gosh, this is the cure all. Or, we these late night infomercials that run about your eye health and everyone needs to be taking this supplement or that. It's just crazy. And I know we're in a society where that's how we believe. It's our belief system to have these kind of thought processes where we just take this drug or we just go buy the supplement. And it's not it's not okay. I think the more specific things that you can address that are for your specific body, for your specific condition, if you have underlying health issues, autoimmune disorders, Lyme disease, cancer, God forbid, um, you're going to have different needs, obviously, which are usually going to be determined through some type of blood test or what's showing up on your skin. I love the pulse thing. I'm gonna talk to you more about that. But the manifestations that show up in your body, you're like, okay, what can we do to address that? And I believe, in my opinion, a lot of those things can be addressed through diet. A lot of the things can be addressed through diet. So we'll definitely
Mhm.
have to talk about some healthy options. So when you talk about a toxin load, Cleo. Can you explain that a little bit more about how either toxicity builds up in the body over time or how the body is not able to remove certain toxins from the body?
Hmm. Sure. So your toxin load basically is just, like I said, all the accumulated toxins that we're exposed to on a daily basis, whether it's mold or heavy metals or plastics or toxins in food or whatever, air pollution and things like that. Everybody is different, like we've discussed, and some people are just predisposed or have genetic factors or DNA mutations that don't allow them to detox appropriately unless they give their bodies the proper tools to do so. So if your body is insulted by a lot of these toxins and you don't know about this in your body, you don't um, understand what's happening in the body, then it just continues to build up over time until one, it causes symptoms, or two, it's just such a heavy toxin load that we need to do a heavy intervention, I guess you could say. But one thing about detox for me that is frustrating, it's like everybody out there is like, oh, I'm going to do a liver detox. Oh, I'm going to do a parasite cleanse. Oh, I'm going to do a heavy metal detox. And it's like, well, how do you know you have any of these things? And people are like, oh, we all have parasites. Yeah, that is true. We all have parasites, but some of them are good. Like, you know what I mean? Have you done a parasite
Mhm.
test? Like, have you been tested for heavy metals? Because you can seriously injure yourself, like doing these harsh cleanses on the body when one, you're ill prepared. Like you said, are you eating Taco Bell and then doing a parasite cleanse? I'm confused. Are you sitting on the couch all day and then trying to detox heavy metals and have never sweat before in your life? Like, where is your body at in order to process this cleanse, and how do you know that you need it? So there's just I don't like that there's all these different detoxes on the market that people are just able to grab and decide that they need to do.
Right, right. No, and I agree with you because we're again marketing, and you're like a parasite. I have wait, what? That's in my gut. I can't see it, so I got to take these things. And you're like, I don't know if that's helpful. What? So when you talk about heavy metal toxicity,
Hmm.
where are people getting? Where is this? Are they being exposed to heavy metals that would accumulate in the body? Where's that coming from?
The soil is a large part. The environment, to the air quality, what we
Mm,
have in our air. Products that we're using. Dental work is a big one that I see with mercury or
yes.
metal fillings. People that have
Yep.
those retainers that stay in their mouth constantly, I see that a lot. I mean, we're gonna be
Yeah.
exposed to it. Again, the goal at the end of this is not to live in a box and be afraid to go outside and be afraid to eat food that was grown in our polluted soil. Like, the goal is to make yourself resilient to all of this and to build yourself up optimally, that when something does insult your system or when you are exposed to mold or heavy metals, that you're not affected by it.
Right. Right. Absolutely. Like your body can naturally detox itself. So Cleo, before we're going to let everybody know obviously where they can find you. And again, we could talk for hours and hours and hours of all this information. So give us some tips. So for the optimum, the people that are looking for their healthiest skin, what are some general things that you would recommend as far as diet is concerned so that you could have your best skin?
Mm-hmm. Well, protein for starters. I'll just name quite a few things that I see
Mhm.
often people or that they are not doing in clinic. Protein. I feel like a lot of us are vastly under eating protein. So making sure that you're having
Mm.
protein in every meal, like at least 30 to 40 grams. Obviously, it's going to depend on your weight, but that's a good starting point. Having a well-rounded diet, like again, not putting yourself in like, oh, I only eat carnivore or I only eat vegan. Like, we're meant to be omnivores. And if you have a problem with a whole food group, that's something that you need to work on internally. So we want you to have a well-rounded diet. Two,
Mhm.
healthy fats. So eating animal fat, eating dairy if you can tolerate it at the time, olive oil, avocado, nuts, fish, Mediterranean type diets. You need fats and you need calcium in order to help the skin repair and also to help synthesize vitamin D from the sun. So yeah,
Yes.
healthy fats, protein, a well-rounded diet. Um, if you are having digestive issues, like obviously cooked vegetables are going to be better than raw vegetables. Getting your animal fats in, so grass-fed, grass-finished ground beef, wild caught fish, organic poultry, not being afraid of like butter, full-fat dairy. Skip the non-fat, low-fat stuff. Um, Foods high in antioxidants, so like blueberries, dark-colored fruits, pomegranate,
Mm.
things like
Yeah,
water,
I
like
say I always say
drink
eat the
enough
rainbow.
water. Yeah.
Yeah. So, and we'll start wrapping up with this. So, will you explain why we should not be consuming seed oils, the things that are
Oh yeah.
traditionally people are like deep frying things in? Like, explain why, because it's they're advertised as heart healthy and like, oh, this is actually good for you. And explain why seed oils are a bad idea.
Sure. So I have a lot of information on my Instagram page about seed oils because I'm against seed oils wholeheartedly, very strongly. Um, I mean, you can look at it from many different standpoints, but one, these oils are highly processed and highly oxidized. Like they use high temperatures, they use chemicals to make these seed oils, and then they're in the bottle that way, and then you get them and you heat them up again, and that further damages the oils and further makes them more oxidized. And by what I mean by damaged and oxidized is that they're unstable, so they go in the body and they
Mhm.
create reactions in the body that lead to oxidative stress and inflammation. They can create more hyperpigmentation in the skin. So think of oxidation as like a charred piece of meat, that black crust that you have on a charred piece of meat. That reaction, the Maillard reaction, can happen in the body from inflammatory foods, inflammation, seed oils, and when that's happening, it's being expressed on the outside of the body. So that's like the mechanism of how stuff like that can create hyperpigmentation. Um, they raise bad cholesterol levels in terms of oxidized LDL, the inflamed LDL, the small dense LDL. They raise triglyceride levels. They can raise um, blood sugar levels. Yeah, I mean, all in all, they're just not something that we should be consuming, and unfortunately, they are everywhere, whether they're packaged foods at restaurants. Um, and yeah, it's a shame that they are at restaurants because I don't really feel like people are buying them to cook at home anymore, but we're still being served them at restaurants.
The restaurant thing, again, we'll have to have you back because we could have a whole nother conversation about restaurant food and like what's actually going into it and the amount of salt and the amount of not healthy butter and the seed oils that things are being cooked in. Like it's a little bit of a dumpster fire when you eat out because you don't actually know what's being put in your food.
Mhm.
But the seed oil thing, most people at this point understand free radicals. Like they can understand that. So when I'm like talking about when you see hydrogenated or you see, these things are when they're sitting on the shelf, not in like a produce section or a perishable aisle in the grocery store. I'm like, you guys, you need to think about there's a reason why that can sit on the shelf and either not be refrigerated, sit at room temperature for long periods of time. It is not good for you. There's a reason why. There's preservatives in the product, obviously, and things when you heat things up, like if you hydrogenate, like a perfect example is, I hear the vegan community saying, well, we can eat Oreos. And I'm like, okay, eating an Oreo cookie, yes, it's vegan. I understand you can eat an Oreo cookie, it's vegan. However, it's hydrogenated crap. And the reason why it has such a lengthy expiration date is because of the hydrogenated crap, which is not good for you. It's producing oxidative stress in your body. Like you'd be better off eating the meat if you wanted to compare the two together. Like if you're so against that, you cannot be positioning that you can just run around and eat Oreos because you're vegan. I'm like, no. So when you're shopping in the grocery store, you guys, you're thinking about it. We always say shop the perimeter of the grocery store because that's usually where the refrigerated sections are. Anything that's refrigerated is usually perishable. It's going to be better for you than something that is in a box or sitting in one of the main aisles that's been heavily processed. We want to avoid that whenever possible. especially when you're trying to have good skin. Hello, hello, hello.
Mhm.
So, Cleo, thank you so much for your time. I mean, and look how quickly an hour goes by. It's absolutely crazy how quickly we can. I mean, there's so many things. We'll definitely have to have you back again because there's more things I want to talk to you about. But tell the listener, tell everybody where they can find you.
Sure. So my Instagram is Dr. Cleo Amelia. My website is www.cleoamelia.com. And yeah, those are the two main places. I'm pretty active on Instagram. And then if you have any questions about services I offer or what I offer in the clinic, you can find it on the website. I also do telehealth. So if you're not in the Coachella Valley, you can reach out that way. And yeah, thank you for having me.
Absolutely. So we will list all of your information also in the show notes for all the platforms, whether YouTube, Spotify, whatever platform you're listening to, we'll put all your contact information in there. And you guys, if you're looking for if you're having a health issue or you're just want to feel better or something's been bothering you and you haven't been helped by conventional medicine, I would highly encourage you to reach out to Dr. Cleo. She is not only a delightful, obviously, as you can tell by us having our conversation here, but she's going to help you identify some root causation behind why you're feeling the way you're feeling and give you some guidance from a position that maybe has not been addressed through traditional Western medicine. So I appreciate you, Cleo. Thank you so much. I'll be coming to
Thank
see you soon.
you.
I appreciate your time, and
Yeah.
we will be talking shortly.
Okay. Have a good day.